esteemed guests, participants, dignitaries, and all the students and faculty, our dear friend Sami Joshi, everyone who is joining this program today. I'm actually very delighted to be addressing you on this occasion when iTransform is launching a set of paramedic centers across the state. In the backdrop of COVID-19, this is indeed a step in the right direction. What pleases me even more is that through these paramedic centers, the effort is to bring trained, skilled young technicians to come and work in areas where there is a shortage and where we in the state and indeed in the country need to raise our capacity to be able to respond. This is a scenario nobody had seen before, and what it has brought to the fore is how underprepared we were. Despite our efforts, even the best performing hospitals felt the need to immediately recruit and bring trained personnel to assist the medical doctors in dealing with the different elements of managing this pandemic. As a public health enthusiast and expert in the state, I'm very happy to see the change in terms of addressing issues of the social determinants of health, building capacity in almost every sector. There has been drastic changes. What we see currently is the medical health sector, because that is what is uppermost concern for people. But I have seen in my travels and in my discussions with others, colleagues around the world, how things are changing. We are moving more towards a digital world. And therefore, I would emphasize here today that all the good work that iTransform intends to do by building the paramedic centers across the state, it's also very important to build capacity of handling the IT part of it, to be able to seamlessly look at reports, to allow machine learning to give you a sequence of what kind of episodes are visible, to be able to not only keep large amounts of data but study them. So the technicians who are being trained in the various courses, they also need some inputs about machine learning and how to read a sort of a curve or a trend when they are dealing with patients on whom they are performing different types of tests. That I think is another area which needs a lot of work. And I would also add that in our country, somehow we don't tend to pay a lot of attention to what we call emergency medicine. For decades, we have looked at traditional trauma care or casualty, some sort of a place you rush a victim to. But training paramedics to handle the injured or those who require emergency care till the doctor arrives, I still feel that is an area that needs a lot of work. Paramedicine, both in the ambulances and then the seamless sort of link to those who are on duty in the ER rooms, is something that we need to build capacity on. And centers such as iTransform can help to bridge that gap. It is not necessary that the paramedics have to perform all the procedures. Just doing basic triage and stabilizing the patient and then handing him or her over to the specialist doctor can help save many lives in the golden hour. Those first few minutes are so crucial. And I think if we can try and train a lot of our youth to fill this gap, and it doesn't necessarily have to be pure medicine, just basic understanding of human anatomy and the ability to perform those functions which do not require a doctor to be present all the time, can help to build the capacity